The reality is the opportunity to use technology to make healthcare better has been the driving force for me in my entire career, starting first in creating the first consumer website that became WebMD, subsequently working at Hippocrates, where we had an application giving doctors information at the point of care to guide the process of care. I started HealthTap 15 years ago with the vision of bringing technology to improve the process of connecting doctors and patients, realizing that we needed to be able to deliver healthcare on technology platforms and that we could do this more efficiently and more effectively than often happens in the office. We were pretty early in the space. In fact, when we first started, the video codecs did not exist to allow for high resolution video on mobile devices, but we anticipated it was coming and prepared for it. We started our first video consultations, I think it was 2012, was when we got started, firmly believing that there was a role for virtual care and that it would, at a minimum, complement the care delivered by doctors in their offices in a more efficient and less expensive way. What I didn't fully appreciate, and it took some time to realize the scope of what's actually possible to do virtually. When you have a high resolution audio and video connection on a platform that is bringing patients and doctors together, it is quite surprising how most of the time, most of what the doctors need to do, certainly in primary care, can be delivered virtually. And even more important and somewhat counterintuitively, we discovered that doctors and patients can connect in very deep and meaningful ways when they've never met in person in the office. The doctor is not laid on hands, but the quality of the connection and the fact that when you have a video visit, the doctor is focusing entirely on the patient, looking at. This is the only thing they have. They have a video channel looking at the patient, and patients respond very warmly to having the undivided attention of their doctors.